Role of ICMR in public health and nutrition. The contents that are included in this video are introduction, mandate, vision, significance, role of ICMR in public health, activities of ICMR, and the achievements. What is ICMR? ICMR is one of the oldest medical research body in the world and apex body in India. What is the mandate of ICMR? The Indian Council of Medical Research is the premier national agency for the planning, formulation, coordination, implementation, conduct or promotion of biomedical research in India. In 1911, the Government of India set up the Indian Research Fund Association IRFA with the specific objective of sponsoring and coordinating medical research in the country. After independence, several important changes were made in the organization and activities of IRFA. It was redesigned as ICMR, Indian Council of Medical Research, in 1949 with the expanded scope of function and responsibility. The ICMR is funded by the Government of India through Ministry of Health and Family Welfare. Rapid advances in science and technology have brought in new technologies to understand the disease process and find strategies for prevention and cure. So, what is the mission of ICMR? To generate, manage, and disseminate new knowledge, to increase focus on research of the health problems of the vulnerable, the disadvantaged, and marginalized sections of the society, harness and encourage the use of modern biology tools in addressing health concerns of the country, encourage innovations and translation related to diagnostic treatments, methods, vaccines for prevention, inculcate a culture of research in academia, especially medical colleges and other health institutions. What is the vision of ICMR? Translating research into action for improving the health of the population, elimination of all forms of malnutrition for a progressive, healthy India. So, what is the significance of ICMR? ICMR is a world renowned center for its research and education in nutrition and health. The Council promotes biomedical research in the country through intramural as well as extramural research. Over the decades, the pace of extramural research and also its strategies have been expanded by the Council. The Council's research priorities coincide with the national health priorities such as control and management of communicable diseases, fertility control, maternal and child health, control of nutritional disorders, developing alternative strategies for healthcare delivery, containments within safety limits of environmental and occupational health problems. So, what is the role of ICMR in public health and nutrition? Today, ICMR is a leader in the field of nutrition and health research, and its work has helped to improve the health of millions of people around the world. ICMR's work focuses on a number of key areas, including the study of role of nutrition in health and diseases, the development of new techniques for measuring and understanding nutrition and promotion of healthy eating habits. ICMR's work has had a dramatic impact on the field of nutrition and health, and its contribution will continue to be essential in the future. Research on major non-communicable diseases like cancer, cardiovascular disease, blindness, diabetes, and other metabolic and hematological disorders, mental health and drug research, including traditional remedies. All the efforts are undertaken with a view to reduce the total burden of the disease and to promote health and well-being. The major activities of ICMR are summarized in this table. Here are some of the achievements of ICMR. ICMR started its research on indigenous drugs in 1919. In 1937, ICMR published Nutritive Value of Indian Foods and Planning of Satisfactory Diet for the first time in the country. ICMR has been conducting annual rounds of vaccination in the year since 1990. In 2019, ICMR partnered with the World Health Organization and 10 nations to launch research collaboration. The aim of this initiative is to combat emerging and re-emerging infectious diseases in the region of Southeast Asia. ICMR has made outstanding contribution as a knowledge-generating agency and contributed in understanding various diseases of national importance such as malaria, tuberculosis, Japanese encephalitis, AIDS, Kala-Azar, filariasis, leprosy, and poliomyelitis. RT-PCR and ELISA were developed in 2019. Covaxin has been developed. Additionally, ICMR has made extensive contribution in the areas of nutrition, reproduction, maternal and child health, occupational and environmental health, research complementing health systems. ICMR regional medical research institutes have been contributing in tackling regional health problems.